Now that we are going back to work after being isolated at home for last few months and the business is opening up, what are we supposed to do if we still do get the coronavirus and how we are going to protect ourselves? Hello, I am Rajitha Bommakanti, registered nurse, faith-based holistic coach, and founder of Healthy You Lifestyle Center. If you want to develop healthy habits for life, one step at a time, click the red subscribe button and the bell icon now. The coronavirus is still a threat. As you can hear in the news, the numbers are going up. And what are some of the precautions that you can take at home? And how can you treat if you do have mild symptoms at home? Join me in listening to Quisha Umemba. She is a registered nurse and a master's degree in public health and founder of Umemba Healthcare Center. She is going to educate us how to take care of ourselves if we do get the virus and how to continue social distancing and how can you meet other people but still practice and be safe in from getting the virus. Hello, Quisha. Thank you for joining us today.
Hi, Rajitha. Thank you so much for having me.
You're very welcome. And that just, I just want to get started with our conversation. Wanted to ask you,
Yes.
how did you come about? You are a registered nurse and you have been practicing
hmm
for a very long time. And then you shifted into starting your academy, Amumba Health Academy. So how did you get inspired to do that?
Well, first of all, yes, I am a registered nurse. I've been an RN for about 13 years. I've worked in inpatient, outpatient, and community setting. In the last 5 years, I've actually been more of a public health professional. So I have a master's in public health. And I just really thought it was very nifty for me to be able to combine both my nursing expertise with my public health expertise. So I put those both together and thought, you know what, I've done this for so long. I've done training and education and consulting. So why not go full speed ahead and start my own part-time, soon to be full-time business, Umemba Health LLC. And so one of the projects underneath the Umemba Health umbrella is Umemba Health Academy, which is an online academy for patients and professionals, a little bit more for professionals right now, in lieu of everything that's going on with COVID-19, really trying to equip healthcare and public health frontline workers to be able to respond appropriately. And so it was just a culmination of my passion, my expertise, and something that I thought, you know what, why not? It's 2020, go for it. So we found it last year. We're about a year old now, and I've really enjoyed it. I've met a lot of wonderful people like yourself, and I'm just excited and honored to be part of your summit here today and to share this information that I have with your viewers.
Wow, that is excellent. So let me just tap into your public health expertise on that. So
Yes.
wanted to ask you, what are some of the COVID symptoms that people need to be looking
COVID.
out for, need to be aware of?
Well, I think the big three major ones are that fever, cough, and respiratory conditions, right? The respiratory symptoms. So the shortness of breath. The I think most people get those symptoms. They say if I get a fever, I get a cough, or I'm shortness of breath, I'm going to go to the emergency room. And so it's the big three that I don't really worry about so much because my husband and I actually traveled to Nigeria and basically got back in the U.S. Just as the U.S. was shutting down
Ooh.
mid-March. We actually experienced some symptoms that didn't really come with those big three. Didn't have any shortness of breath. Did not have, well, my husband actually did have a fever. I never had fever for one day. And I also did not have a cough per se, but had a lot of those other symptoms. And so that's what I really want to impart on your viewers. So a lot of those other symptoms, you can have muscle aches and pains, which is very common with flu-like symptoms or a bad cold. You can have a loss of taste and a loss of smell, which I actually had a loss of smell for about 4 weeks, smell and taste for about 4 weeks. I burned up food several days in the kitchen. But of course, you can't have that fever, you can't have that cough, you can't have that shortness of breath. So if you have any of those, you definitely want to talk to your provider. Those will be what we will call mild or moderate symptoms. When that shortness of breath becomes chest tightness, when it impedes your ability to, get up and walk, around your house, when you can't lay flat and sleep, when it gets to be that point, then it's definitely a lot more severe. And that's when you want to go into either call 911 or go into emergency room to be tested for your symptoms.
Wow, that's you differentiated very well between what symptoms can be managed at home versus when they need to go to get additional help to the emergency room. Thank you on that.
Absolutely. You're welcome. And while we're talking about, managing symptoms at home, that's one thing that really, I know for us, and I will say this, personally, my husband and I, we did travel overseas. We came back, we had symptoms. We had a completely different set of symptoms. My symptoms were more along the coronavirus symptoms. His symptoms were more of the flu-like muscle aches and pains, the chills, shivers, whatever you want to call them, and fever. And so it was completely different. But being a nurse and also being a patient at that time, one of the things of concern for me was watching the news and hearing about all the people that were in the hospital that were going through the serious illness of coronavirus. But nobody at that time, and this was a couple of months ago, was really talking about, okay, this is what you do when you have mild symptoms. This is what you do when you're at home managing. And so that's why it's very important for me to actually talk about that home symptom management. Of course, now you hear it more, and you manage it just like you would any normal flu or a severe cold or something. And so I want to recommend to your viewers, it's symptom management. If you've got a headache, you take what you would take for a headache. If you've got a fever, you take a fever reducer. If you've got muscle aches and pains, you're going to take what you have for muscle aches and pains. It's until you get those severe symptoms or until you get some symptoms that are just completely out of ordinary for you that you're actually going to pick up the phone and start calling your medical provider. Aside from that, you're going to manage it just like you would any other illness that you would normally have that comes on a seasonal or annual basis.
Okay. And talking about managing that at home, do you advise about any like nutrition, hydration that they are managing at home with their symptoms?
Absolutely. And that was one thing that I always, because of course, being a nurse, I'm my husband's nurse as well. Trying to get him to stay hydrated, drinking plenty of water. A lot of times when you're sick, you don't have an appetite. And this can be, okay, if you're trying to lose a few pounds and you don't have any problems, I'm not going to say too much about it, but if you have other comorbidities like blood pressure issues or diabetes, you cannot go without eating. So this is where you want to have something on hand that's going to be, say you don't have an appetite, but you still need to eat. So you want to have maybe some protein shakes on hand. You want to have some Gatorade on hand or something that's going to give you some type of calorie, something that's going to help your electrolyte imbalance so that you stay dehydrated. If you can only nibble on fruits and vegetables, then that's fine as well. I know a lot of people don't have an appetite. I will tell my patients as well, even if it's toast or applesauce or bananas or something that's very light, just make sure you have some type of fuel for your body, especially if you have a fever. If you have a fever, your body, your metabolism is in overdrive. It tends to burn a lot of calories. You're doing all the shivering and the shaking. You definitely want to make sure that you're staying hydrated and that you're able to put some form of energy into your body.
Okay, great. Thank you. So at this point, do they need to go to their provider or the hospital to get tested if they are positive for COVID or not?
That's a very good question. I know right now we're hearing a lot about what's called contact tracing. So first and foremost, you want to call your provider at any symptoms, or even before you've had symptoms. And this is something that I tell my frontline health workers when I'm providing them with education. I'll say, if you're working with a client or a patient that says, my mother came to stay, she went home, and then she later found out that she was positive, she tested positive for coronavirus. This is when you're picking up the phone and you're calling your healthcare provider and you're saying, I don't have any symptoms right now, or maybe you do, but this is what happened. I've been exposed. This is when I was exposed. This is how many days it's been. You definitely want to keep your provider in the loop. Not only do you want to tell them at the initial onset, but you want to tell them when things change. Case in point, using myself, I went ahead and got tested about 2 days after we came back home on a Saturday. I got tested on a Tuesday. When I got tested, and this was 2 months ago, the tests were not coming back in 30 minutes or 3 hours or 3 days or what it is now. I actually have to wait for about 17 days because it was a backlog before I got my results. But I went ahead and got tested. Of course, I was showing symptoms at that time, but that was on a Tuesday. On a Friday, because my symptoms had changed and how I was feeling was changed, I even called my doctor's office, spoke to my doctor's nurse and said, this is what I'm experiencing. Now I've lost my sense of taste. I know this weekend is coming. I just want you to give me some recommendations and some advice on what I should do if X, Y, and Z happens over the weekend. During the course of the 14 to 17 days that we were not feeling the best, my husband and I actually called my provider probably 3 times within that 2-week frame, just keeping them abreast of everything that was going on. And so I would recommend that to your viewers as well, just because there may be something that your provider can tell you or that the nurse can tell you that you may not be looking at. And so it's always good to keep them in the loop. And also, if you do come in contact with someone or you do have symptoms, it's good also to notify individuals that may have come in contact with you. We did the same thing with my family. When we came back, we had visited family and we said, look, we've been tested. The results are not back. Just wanting you to know so that you can quarantine yourself as well.
Okay, so great. So does that mean that, okay, let's say, your test came back and it was negative. Does that mean that you don't have COVID because the test came back negative and you can go back to doing whatever you used to?
Yeah. So I think that's kind of a loaded question, and I'll speak from personal experience, and then I'll give just some recommendations from a general public health recommendations. In my experience, again, it took about 16, 17 days before my results came back, and I clearly, when I was called, and they did call me a week later, maybe 9 days later, and say, we've got a quicker test available. Do you want to be swabbed for that one? And who wants that? That swab goes up really far, And I thought, no, it's not going to change the treatment. And it didn't. It would be different if I went to the doctor and they gave me a prescription and, I came home and started taking that. And then if they needed to change the prescription or the treatment, that would be different. But the treatment doesn't change. And so for me, at the time, I was working from home. I was already quarantining, so to speak. It didn't change the treatment, so I didn't feel the need to be tested again. So the test came back as negative. And I thought, oh, really? I have the weirdest symptoms. Are you sure it's negative? And the nurse says, but we're seeing up to 40% false negatives. So you probably did have a mild case of coronavirus. And I was like, so do I go back to work? Of course, we're still working from home. At that time, we thought we were going back to the office. And she says, do you still have symptoms? And I said, no, they went away, a couple of days ago, the last symptoms. She said, as long as you're symptom free, then you can go back to work. And so I think that is the general recommendation, is that, they are testing certain individuals of people again to ensure that they do test negative. But for the general public, you are free of coronavirus, supposedly, once those symptoms go away after that 14 days. Now, keep in mind, in regards to actually spreading the coronavirus, you could actually show no symptoms anywhere from 1 to 14 days and still have it. So this is where that slippery slope is, and why we're still continuing to transmit the coronavirus the way that we are.
Okay, thank you. There just for a little bit, had little internet issues with the
Yeah, it seems
connection.
to be, I can see myself fine, but your connection keeps going in and out.
Yeah,
So I hope that the viewers won't see it that way.
yeah. So, yeah. So moving forward, so wanted to ask you, in terms of even if you don't have symptoms, if somebody wants to go
Mhm.
get tested, or if I think, oh, maybe I was exposed to it, I want to go get tested, where should I be going and getting tested? That's a reliable
Mhm.
place.
So start with your primary care office or your local health department. I will say this, a lot of places, and rightfully so, are not just testing you just to test you. So there are, according to the CDC, there are priorities, individuals that are tested. So the first priority, anybody that's hospitalized and anybody that's working in a healthcare facility, they have priority number one to be tested. Second priority is a step down from that. Of course, other essential workers, and then people that live in like nursing homes or long-term care facilities or something like that. Again, there's these people in a captured type of environment where they're all living together. That's the second priority. And then third priority is going to be people that don't work in healthcare or facilities per se. They work in the general public, or they're a part of the community, but they actually have symptoms. So if you have the symptoms, especially if you are in the high risk population, you're definitely going to be tested then. But there are few places that I'm aware of now that will actually just test you just because you're curious about your status. Now, if you've been in contact, like for my husband and I, we had traveled and we also had symptoms. So of course we got tested. I do believe that our provider, had we not been having symptoms, would have probably still tested us just because we had just recently traveled to another country and then have to, take several flights to get back home. But if you don't have any of those factors, no travel, no symptoms, no contact with anybody, let's just say you're anxious and nervous and you just want to put your mind at ease, you may actually have a hard time trying to find a facility that will test you right now. Now, this may change, and it's certainly not everywhere, but there are priority populations that will get testing before someone that has not had contact, not traveled, and does not have symptoms.
Okay. All right. Thank you. And in terms of how does somebody quarantine themselves, or social distancing? What are some of the best practices to follow?
I think when we talk about, let's talk about inside the house, because a lot of times I think we can kind of see what social distancing is when you're outside, right? You're 6 feet away from someone. If you go to grocery stores or a lot of other agencies, they kind of have markers everywhere. So it's easier to see, every time I go to HEB or Walmart, they've got the little markers. I know how far to stand from people and so forth. The biggest issue, I believe, is people isolating and quarantining inside the home, which can be difficult. So first, I want to talk about the difference between isolation and the difference between quarantining. So when we talk about isolation, we're actually talking about someone that's already sick, someone that already has positive, identified as positive with coronavirus. And this person, we don't want them to infect anyone else. So we're going to isolate that person to one room. We're going to assign them, if possible, one caregiver. So, one person going in and out of that room to bring them their food, their toiletries, their clothing, whatever they need assistance with. That's isolation. And we want to keep those individuals in there during the duration of the time that they're sick, but at least those 14 days. When we talk about quarantining, these are individuals that are not yet showing symptoms, but have common contact or may have common contact with others. You still want to quarantine those 14, 15 days as the global recommendations are, but this is going to be a little bit different. And so when we're quarantining, it's a little hard to do in the house. You certainly don't want to isolate yourself, but you do want to stay inside of the house. The biggest thing is to make sure that if there's someone that's sick in your home, that individual is isolated to one room. Let them use one bathroom by themselves. Let them have one bedroom. If you're a husband and wife and the husband's sick and the wife is not, sorry, you guys need to sleep in different rooms for a couple of days, just until the other person gets over. You want to make sure that you keep that room ventilated, maybe raise up the door so good air is coming in, germs are going out. I thought I silenced my phone. Sorry about that.
That's all right.
And but I think I answered your question, though. That's the major difference between isolation and quarantine. And like I said, it's a lot easier to do when you're out in public versus when you are at home.
Yeah. Okay. And when you're out in public, what should they be doing? Putting the mask on. What are some of the recommendations out in the public?
I think being socially responsible right now is abiding by those recommendations, wearing your mask. And this is the thing, you're not wearing the mask for yourself, right? You're wearing the mask for other people. And so definitely wherever you go, I mean, if you're in the car, it's fine. Sometimes I realize I'm halfway home and I still have the mask on my face just because I haven't taken it off. But you definitely want to wear the mask when you're outside of the car, when you're at the grocery store, when you're just out and about, if you're going to come in contact with anybody. Even if you're out on a hike at the parks or anything, and it's a heavily populated trail, and you have someone may come in your personal space or within your 6 feet, you definitely want to wear the mask. I have some clients that are older, so we know that seniors are one of those populations that are more vulnerable. And so they even wear gloves when they go to the grocery store. So I've had to sit with them and talk to them about, okay, well, make sure when you wear the gloves, you take them off at a certain time, because you don't want to just turn your clean gloves into dirty gloves. And then you've got dirty handprints and you're sharing germs everywhere. Put some hand sanitizer in your purse if you're a woman, or keep it in the car. You can even take some of those Lysol wipes as well, wipe down the outside of the door. You can do that in the house as well. So one thing that we did when we were sick is every day I would get up and I would take the Lysol bleach wipes and I would wipe down all the high touch areas. So these are, the light switch that you turn on and off, the doorknobs for every door, not just outside of the house, but every door in the house as well. The handles in the bathroom, the knob on the toilet. We use a fan a lot. So the little string on the fan that you pull down, any high touch area that you don't normally think about, we were disinfecting that as well. One of the things that I said a few minutes ago that I didn't realize was so important is ventilation of the home, until I actually started researching mild symptom management of coronavirus at home and the World Health Organization's. We were not doing that. As soon as I said, let's start opening up the windows every day, I don't know, it's something about fresh air and nature and sunlight. Yeah. And as soon as yes, absolutely. As soon as we started cracking those windows every day, I swear that day we started feeling so much better. So those are just some of the things that you can do to really, not only outside, but inside of the house, that will really help you to start feeling better and to prevent the coronavirus from spreading.
Okay, good. These are some of the good practices that not just during this time of the coronavirus, we can continue doing this all the time to keep ourselves, sanitize and clean some of those areas which we totally forget. How many times we touch them, it does not even occur. Great. Thank you very much.
Absolutely.
So when should somebody, can go to their elderly parents? Now I know now that, because they are more vulnerable, they can, get virus pretty easily from others. It's been quite some time and people are getting distressed from not seeing their elderly parents. So when can they do that?
So this is something that my husband and I recently talked about, because, personally, we just moved and my family has not yet visited us here where we live. And so I have about 10 relatives that are going to come and visit us at the end of next month. And so we kind of had to make this decision, like, are we ready to start accepting visitors? Are we not gonna, first of all, I'll tell you about that, my personal, how we're gonna address it. But to answer the first question, my business is virtual. Umemba Health is virtual. I've been in the virtual game for a few years, and I believe that that's just the way to go, right? It's a silver lining in the cloud, I think, of this whole coronavirus pandemic, that thankfully we've got the internet, we've got Zoom, and we've got StreamYard and all these other technology enabled platforms that will allow us to do this. I would say tap into those resources. I've got a sister that lives on the East Coast. I've got my family that's in Arkansas. I've got friends and clients and partners all over the world, and we don't see each other except for in platforms like this. So if you have an aging aunt or uncle or mother or father or whoever it is, and you want to stay connected to them, there's FaceTime, there's Facebook, there's all kinds of other social media sites. If you're on Samsung, there's Duo, which is just like FaceTime. There's Zoom platforms. There are things like this that you can do to stay connected. I know a lot of times people feel really uncomfortable with technology, but this is the best time to just get in there and do it. We're starting to see how great these type of platforms can be when we talk about telemedicine and telehealth. If you weren't seeing your doctor through e-visits or telehealth visits, chances are you're probably seeing them through them now. And so doing some of those things, I've got a nephew. I've got my first nephew who's 10 months old that I've seen one time in his life. I talk to him every day, and I do it, through an app called Marco Polo, which sends video messages back and forth. So that's my first thing. Stay safe. If they're worried about it, but you still want to keep a connection to them, then tap into technology to be able to keep that line of communication open. Secondly, I'll say this: we've got to learn to continue living right. We've got to be safe. We've got to be smart. We've got to be conscientious about it. I've already gave my family the spiel. Everybody has to wash. There's going to be hand sanitizer upstairs and downstairs. I've told everybody they can't leave their house and go anywhere the week before they come to visit me. They're only allowed to stop at certain places on the way. It's about an 8-hour drive on the way here to use the bathroom. I went through all of those things, but at the end of the day, we've got to still live. We're not throwing house parties. I've got some neighbors that are doing that, and that's their prerogative. But this is my mother, my father, my sisters. These are my close relatives that I haven't seen in several months. And we've decided that, we're going to do the best that we can. We're going to stay safe. Everybody's, when we go out, we're going to wear a mask and do social distancing. But for our immediate family, we have decided we're going to come together after all these months and everything that's been going on. We are going to come together. So I think you have to be responsible about it. You have to think about what's best for you. If you have anybody in your family that may be high risk or, in any kind of immediate danger, you want to really think about that. But that is something that it's not lightly, it's not to be considered lightly. And so we just have to learn to exist with coronavirus. That's unfortunately, I wish I had a better answer, but that's just where we are right now.
Okay. Thank you. I think, some of these practices are like, whether there's coronavirus or not, they are good practices to keep following them
Yes.
throughout. And also during this time, eating good, healthy, nutritious meals to keep that energy level up. And so that to avoid, other exposure to other illnesses. So that's also important for us to continue doing it. So thank you for that explanation,
Absolutely.
how you are handling your family gathering.
Absolutely. And I also forgot to say, I'm here in Austin, Texas. It's very beautiful, very outdoorsy. lots of hiking and hills and lakes. And so I told them also, like, we're not going to be at the house. And that's one way that you can also have, family together, is to go out to the lake, go to the park, go hiking, go somewhere where you're able to spread out a little bit. You're not in the house cooped up on top of each other, breathing on one another. And so that's a way that you can also enjoy your family and friends, but not be so enclosed together.
Okay, right. Thank you. What is the one advice you can give to our audience that they can take?
About what?
About, what precautions that they need to follow, the safety way, what can they learn from this and implement so that they can follow. This is something for them to right away use it and start implementing in their life.
I'm going to say, just because we were talking about, and like you said, all of these tips and tools and advice that I'm giving can be applied all the time. But I'll tell you something for me that I've noticed. Before this happened 2 months ago, before we started working at home, I was always the person that was like, oh, I want to work from home every day. Oh, I want to work from home. I've realized working from home is not all it's cracked up to be. And I think that at a certain point, after so many weeks of not really going out to stores except for necessity, not going to work every day, it really can take a toll on you mentally. And so if I would leave any message for the viewers, is to take care of yourself mentally. You've got to get out. If that's putting on your mask and taking a walk, around your neighborhood, get some sunshine, get some fresh air, feel that cool breeze, take your dog out, do something for your mental psyche. Right now is a very tough time. Coronavirus is scary. There's a lot of fear. There's a lot of anxiety. That's all they talk about when you watch the news. You continue to see the death rate go up higher and higher. But more so than the death rate is the recovery rate, right? So we've got to be positive. You can have coronavirus and you can live past it. And so make sure that you're taking care of yourself, not just physically, make sure you're taking care of yourself mentally and emotionally, because if not, that certainly has a toll on your physical.
All right. Thank you. That is very helpful advice, because whatever we feel mentally, you don't think about it, but it will reflect on your physical health sooner or later. So thank you.
Absolutely. Absolutely.
And where can the viewers find you if they want to follow up with you?
Absolutely. So you can find more information about Umemba Health by visiting the website. That's www.umembahealth.com, and that's spelled UMEMBA health.com. You can also find me on the same with the same tag on Instagram, LinkedIn, Twitter, Pinterest. I think that's it. Yeah. On all the social media sites under Umemba Health as well.
Great. You're active on pretty much all the social media sites. That is wonderful, that it's easy for anybody to get in touch with you and follow up with you. And
Absolutely.
Quisha,
Absolutely.
I want to thank you for your time today, and I appreciate all the wonderful advice you have given it to us.
Well, thank you so much for having me, Rajitha. I've enjoyed the time talking with you today. Uh-oh, I think it got stuck.